各位观众，大家好，欢迎回来收看港湾 TV。今天是2021年1月11号，转眼一瞬间，今天是今年的第2周的第1天的新闻简报，新冠疫情的新闻简报。上星期的1和4分别是这个500多、600多、500多、500多，结果到了星期4的时候是761。那么礼拜5呢，他们是给的书面的数字是600多。礼拜5以后5到6、6到日、日到1这3天，那今天就是分3个阶段给大家汇报了，所以请大家稍微耐心一下，马上就会开始。我个人认为不容乐观，因为现在距离圣诞节2个星期多一点，正好是这个病毒的潜伏期结束的时候该发的人也就发出来了，请大家再稍微耐心等候一下。好，开始了。他们还不算晚啊，迟到了3分钟。
Good afternoon. My name is
先来的
Adrian
是
Dix.
卫生厅厅长 Andrew
To my
Dix，
right is Dr. Bonnie Henry, BC's
后面是
provincial
我们的
health
首席医官
officer.
Bonnie
This is our
Henry。
COVID-19 briefing for British Columbia for Monday, January the 11th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday,
礼拜2、礼拜3都是书面的新闻简报，大约3点钟左右发。
including case numbers and the progress of our immunization.
那么现在呢，还多了一个疫苗的更新礼拜4呢又会重新回来。所以好，现在多一个数字了就是有多少人接受了疫苗。
Thank you very much and good afternoon. So today we're reporting on our weekend numbers. So 3 reporting periods from January 8th to 9th. We had 538 new cases diagnosed with COVID-19 in British Columbia. From January 9th to 10th, an additional 507 new cases. And in the last 24 hours, 430 new cases. That brings our total number of new cases diagnosed to 1,475, including 9 epidemiologically linked cases. And our total in the province to 58,107 people who've been diagnosed with COVID-19. The new cases include 287 people in the Vancouver Coastal Health Region, 736 people in the Fraser Health Region, 59 people on Vancouver Island, 217 people in the Interior Health Region, 173 people in the Northern Health Region, and 3 who are new cases who normally reside outside of Canada. We currently have 5,220 active cases in all health authorities in British Columbia. of whom 358 are in hospital currently, 72 of whom are in critical care or ICU.
住院人数下来
We
了
have 7,313 people under active public health monitoring in all of our health authorities,
好
plus some
关键是
additional
看
in
死亡
Northern
多
Health,
少人数啊
and 50,541 people
5万多
have
人已经
now
痊愈
recovered from COVID-19. Sadly, this weekend we've had 22 more people
22
who have died in our province
22
from
啊
COVID-19,
那么
and that means
900
now we have over
1000
1,000 people, 1,010 people who
1010
have
个
died
了
from COVID-19
好
in
关
British
键是
Columbia.
看有多少人接受疫苗了
These, of course, are our grandparents,
啊
our
都是说我们
friends,
的
our
祖父母
aunts,
辈的
our
我们
uncles,
的朋友
our
我们
sons and
的
daughters.
亲
To
戚
the
就是亲戚
families, care providers, and communities across British Columbia, we know that this has been a most challenging time. Our thoughts and our prayers
那
are
也
with
是
you.
说到了这个诚挚的哀悼啊，给他们那些
We
失
do
去亲人
have
的痛
6
苦。
new healthcare outbreaks to
又有
report over
新
the last
6
few
个
days. At
6个
Avalon
新的
Gardens,
这
the
个
Gatehouse
这些
Group
长期护
Home,
理院
Guildford Seniors Village,
它一个一个
Heart
报
House
名
Long-Term Care on
这
Vancouver
个是真的
Island,
是太
King
厉害了
Village, West Court,
6个
and
了
Sun。
那
Creek
么
Village.
新增人数呢略微
And
下降一
additionally,
点
4
啊，
outbreaks
希望
have
我
been
刚才
declared
说的都
over
是
at the
臭嘴
Abbotsford Regional
那个
Hospital.
我说是会增加
And thankfully, the outbreaks at Bailey House, Chartwell, Langley
那
Gardens,
么
and
他还说
Lakeshore
是
Care
3个已
Center
经
have finally been
官
declared
方
over.
已经宣
And
布这个
we
正式
know
结束疫情
how challenging those
啊，
outbreaks
他
have
说我
been
知
in
道
all
他们
3
这些
of those long-term care
如何
homes.
困难
We've
的
had
度过了这些困境
numbers of
那么这些数字
our
都很
seniors
大啊，都是老年
who
人
have died from the virus
都
in
死
those
亡的很
outbreaks.
多
It's always challenging.
啊，肯定是
We
很
now
困
have
难，很有
50
挑战
active。outbreaks in
那么
long-term
现
care
在还是
assisted
50
living
个啊
and
，50个
10 in
爆
different
发，
acute
有
care
10
units
个呢急诊性早疗
involving
所，就是50加6，
1,364
那有
residents right now
1364个
and
居民，
669 staff who have
669个
active
员
cases.
职员啊，这个阳性。
Today, we've had 1 new community outbreak declared in Canham Lake First Nation in the Interior Health Region.
啊，这个
In
内陆
addition,
的第一
the
原住
LNG
民
Canada
这个
Diversified Transportation Site in Kitimat, that outbreak is now
就是这个就是那个就是上次说天然气那个工厂已经
Since
结
the
束了
start。of our immunization
好，那么现在
program
说的
in
是
December,
疫
we
苗
have now delivered 59,902 vaccinations as of
59,902
yesterday, so it
到昨
doesn't
天为
include
止。
today's doses. But that's 59,902 of the 71,200 doses that we've had here in the province.
啊，一共
That includes 48,533 of the 50,700 doses of the Pfizer
那么
vaccine
里边5万
that we
多是
received,
辉瑞，
and
还有
11,369
多是
of the
Moderna
20,500 doses of Moderna
莫德纳
vaccine.
啊，那么一共
And we
是
recognize we've
一共是到了71000支，那么现在已经施打了，昨天是施打了59902个人。那么它也是主要是辉瑞的疫苗呢，主要是运输主要是给那么运输困难，所以呢，莫德纳的疫苗主要是给偏远地区、偏僻的农村以及原住民的地方打。因为这个储藏的原因不能长时间暴露在常温下。我们还在这等待更多的疫苗过来，过2天还会很多人会来。那么莫德纳会给我们额外的一批货物。
As we spoke about last week,
那么上个星期呢，我们已经有了很多的想法，都讨论了很多的关于疫苗的这个施打的步骤。那么我们是希望现在是一步一步稳步向前，数字慢一点，数字少一点，但是稳步向前。那么现在主要是因为供应量有限，所以我们现在主要是把这些疫苗在最高风险地区去打，社区去打。所以希望大家都看到，我们现在因为疫苗都过来呢，到3月份之前都有限对我们来讲，每一个人都是很重要的，每一个生命都是重要的。 所以我们是根据最需要的人，每个人都有权利需要打这个疫苗，所以我们要评估最风险高的
it means they're either more likely to have severe illness or their circumstances or activities make them more likely to be exposed to potential spread the virus.
那么他说高风险的呢，包括了那些容易多生病的，暴露在病毒的环境下的，或者是特别容易得重症的这些人，对我们来讲定义为高风险的人，先给他们施打。3月份之前，因为疫苗特别有限。那么，所以这个呢，也是我们也要保护我们的社区。所以我们也看到了，我们是国家其他省也是差不多的，同样的这个策略，也看到了其他的省也是这个住院的人群的分布，也是这个年龄段所以都是有贡献，都是有共性的。所以我们会给每一个人都有一个安全的保护。我做我们最快的尽我们的力量，所以我们会重点关注，我们会期待更多的疫苗过来。那么4月份以后呢，我们会有更详细的这个第一批疫苗打完了之后，哪些有这个抗体的情况，以及这个整个社区的防疫怎么样，4月份就会知道了这个初步的数据。为什么大家都说在3月份以后呢？因为这个呢是对于我们来讲，是我们本省的第一手资料，所以这个要有时间的积累。所以我们也要确保，我们现在就是要那些年龄段的还有这个他们的身体条件，以及这个那个还有就是基础工作的这些暴露风险的人所以这个是给他们打，所以请大家稍微耐心一点。那么上次说过了，就是我们的第一剂和第二剂的时间间隔是35天，上次也说过了，1月底之前都是打第一剂那么这个也是根据上次也解释过，今天刚才也说了那么一旦人体接受疫苗的话，我们自己的人体的疫苗系统、免疫系统也被激活，也有一个抗体。所以我们现在也得到了很多的信息，知道这个疫苗是很有效的。那么第二针来的话呢，会更第二针的话呢那么更加提供更长时间的免疫，所以这个为什么要打2针第一针其实它的意思就是疫苗已经有限了，已经在你的身体里边建立了这个抗体了。但是呢，为什么要打第二针？因为第二针的话会把身体里边的抗体的时间会更长，那么让身体呢逐渐的建立起这个防线。所以这个也是说了，他解释了为什么35天这个呢，因为毕竟是科学家，那当然了，我们要选择相信不能说是阴谋论，说他是首席医生他是因为疫苗有限人家21天、28天，我们一定要35天。我相信他还是要从总盘考虑。所以他说，我们现在的重点关注是那些高风险的人群那么所以呢，第二针呢是从1个月以后要开始打第二针了所以这个是我们到3月份之前的施疫苗的策略那么这个要看到了，因为我们接受到疫苗的货量所以上次说了，就是到3月份之前，第一针和第二针的间隔是35天。
We did in December, more doses in February than we did in January.
那么他也是说到了12月份、1月份，到了2月份，到了3月份会越来越多。那么说了12月份以后呢，供货量会更加丰富充足，所以我们的决定我们是希望就是能够把疫苗更多的人那么同时呢，也让我们全省能够有安全的输出这些疫苗，这是我们所考虑的。所以我们也会慢慢的要观测这些科学的结论，包括国际上的，以及这个很多的这个我们本省的免疫的专家，以及世界上的很多的科学 专家们看看我们看看整体的免疫的情况怎么样。所以这个都是要4月份以后才会有一个详细的评估。所以目前为止，我们还是用美国世界的和加拿大联邦的这个卫生指引。所以这个我们联邦也有这个联邦免疫计划，也是指引。那么 BC 省目前也是参考这个以及世界国际的免疫这个抒情计划。那么这些呢，因为都是一些最基本的，包括厂家世界卫生组织给的都是一些最基本的这个卫生指引这个免疫的疫苗的指引他们的给的建议，包括英国美国他们都给了一些具体的指导。那么我们也是通过从实验室以及诊所获得很多的信息，收集了很多的信息。我们也看到了很多的这个诊断的数据。那么第一针打完了2个礼拜以后，身体的免疫开始激起了那么抗体已经建立了，开始。那么这个第一针打完2周以后的这个疫苗的有效92%了。今天我是看到了92.6%辉瑞以及这个莫德纳也是这个数据所以他说对大家来讲这个数据其实是相当的欢欣鼓舞的，所以这个所以这个短时间里边是肯定可以用的，第一针就够了。所以第二针的保护期主要是从这个92.6以再往上走主要是这个问题。那也是到95%莫德纳是91%到95%。他说，所以你可以看到这些数据，也就是说，第二针这个有效率提高的有限，但是主要是把这个身体的抗毒的时间延长了。所以这些都是诊断出来的数据都证明了，主要是大家打了辉瑞这个以后第二针打了辉瑞以后。
And the Moderna trials, they received the second dose day 21 to day 42. And there was no difference
然后呢，都是从这个21天到42天莫德纳，然后辉瑞呢是从21天到49天都没有区别。就是说，你第一针和第二针就是在这个时间期里边，什么时候打区别不大。那么主要是第二剂的这个时间，目的是主要是为了这更长的时间身体里边有抗体。这个是他今天的解释。唯一的现在要求就是第一针和第二针的间隔不能太短因为第一针叫 Prime 是最基本的这个疫苗打进去之后，要2个礼拜以后身体开始建立了自己强烈的这个防疫抗疫防线。那么这个呢，已经2个疫苗基本上都是在90%以上。那么第二针呢，就到了95%，其实提高的不大但是主要是为了就是让自己的身体的抗体时间更长。那么他也是说到了这个世界卫生组织也都会慢慢制定这个2针的时间的标准是42天这个最长是42天，这个都是表明了第一针之后的有效期和安全期的打第二针所以他也是说的我们这个35天也是根据这个我们的供货量同时制定我们的有效性，根据疫苗的有效性以及这个供应量来做出这个决定。我也说了，我们其实在医学上也有一些讨论。那么大家都在讨论，即使不打第二针，在短期里边身体里边这个抗体水平也很高已经建立起了这个免疫的防线。
with the very high levels of protection that we're seeing after the first dose or in the particularly short time frame that we're talking
所以他说在短时间的里边比如说28天和35天没有什么大的区别人体的第一针之后建立的抗体防线已经没有什么大的区别所以他说我们省才现在我刚才这个数字没听清楚对不起他说可能有10几万是5-6万那么他说这个是完全高风险的所以这个也所以我们还要根据将来获得的这个疫苗的数量来调整这个第一针和第二针那么目前就是35天那么大家都可以在我们的 BCCDC 的网站有关疫苗的这个基础知识以及介绍可以看到很多信息我可确保大家能够安全的也有效的获得这些疫苗这个都是给大家保证的同时我们也会紧密的观测这个包括全球其他国家我们国家的其他省份他们的这个疫苗包括英国那么他们可能说6到12周都要打6周到12周都在打我们都在观察他们的做法我们也会紧密观察同时也调整我们的这个2针之间的周期的策略这个主要是考虑到这个第一针的疫苗的有效性以及时间保护期所以那么目前为止我们尽快的到了隧道的尽头希望大家继续努力能够把这个曲线拉平希望我们能够建立我们的自己的防线保护我们的社区我们一定要手握手手拉手我们大家脸含着微笑就算我们戴着口罩也要露出我们的微笑给我们的邻居我们表现出我们的热情表现出我们的容让表现出我们的容忍相互之间提醒支持帮助就像我们去年这样我们现在一定要记住我们马上就要这个游戏要结束了这个战争要结束了但是我们这个现在我们周期上这个疫苗的供应量有限我们一定会度过这个困难我们一定
And they will get us through this next few
不管我们走多远我们一定会战胜这个困难的我们一定会赢得战争我们也会保护我们的社区
Using our layers of protection,
所以同时要一定要强调我们的保护措施戴口罩洗手
no matter how much we want to ease up. These are the things that will get us through these next few months.
还有接下来几个月那我们坚持我们已经到了隧道的尽头了越来越近了所以希望大家还是这个3个to be kind, be calm, be safe 谢谢大家那么卫生厅长呢也就总结一下这个72个重症监护的人各个卫生局的分布以及22个死亡的人各个卫生局的分布那么他也是说到了他也会和往常一样这个22个死亡的人表示沉重的哀悼在过去的3天里边那么5天礼拜5礼拜6礼拜天3天他说了这个飞沙和内渡和岛上那么是13个人5个在北部同时呢他可能礼拜1可能也会汇报一下这个本省的医疗物资储备的更新那么他也是说代表省长
has said we have 5,220 active cases of COVID-19 and 7,315 people under public health surveillance. Since the beginning of our influenza campaign, 1,413,131, at least that many doses of influenza vaccine have been put in people's arms in BC, which is, I think, an extraordinary success. That's not all of the numbers, because there's a lag in reporting there. 358 people in hospital, 72 people in critical care, and today the good news, after some very difficult, hard, harsh days, for all the people associated with Bailey House, with Lakeshore Care Center and Langley Gardens.
那么他也是说到了，现在有72个这个重症监护
The work being done in public health care right now is extraordinary.
就是说有些特别困难的长期护理院已经被宣布这个结束疫情了。
Dr. Henry has noted that 59,902 people have received COVID-19
那么他也是说到了，目前为止已经59902个人已经接受了疫苗，第一针。
available doses as of yesterday. And
这是昨天为止，今天还没算。
Our doses have been distributed very widely in that case.
那么主要是莫德纳呢，主要是分布大量的分布在内陆和偏远地区。辉瑞呢，因为量多一点，所以都是集中在人口多的地方。因为辉瑞的疫苗呢，储存特别要求高。
We're likely to be essentially entirely out of vaccine by the time those new doses arrive, and that is going to be the pattern over the next periods. And so sometimes I think the debate is what percentage, and people talk about what percentage of the vaccines are in people's arms. Well, that will approach 100% in the middle of the week, and then of course when the new vaccines arrive it will drop down. But what I think everyone can say is that in every part of our province, from Hartley Bay to Vancouver to Terrace to Fort St. John, everywhere in our province, that the work being done by people delivering on this campaign of these vaccines is truly extraordinary. I wanted to note, given the hospitalizations and critical care numbers, that our current occupancy of regular beds,
现在的驻床率
beds in healthcare is 87.8%, so well below 100%.
现在是
70%，78%
那么离开100%还有一点距离。
The overall number of beds, including the surge beds that have been added, that is 69.3%.
70%不到69%，所以驻床率还可以，69.3%，这个还可以。那么现在看看 ICU， 就是重症监护的占床率是多少？他说跟其他的71%，所以都还可以啊。这个他也是说了，跟其他的省份比起来还相对可以。大家可以听到了，安省和加州都有，加州不是所有的地方，有些均线特别的严重了。
The changing nature of COVID-19. When we had 149 cases, which is our height at the beginning of April, there were 72 people in critical care. Today, there are 358 people hospitalized.
那么他也是说到4月份的时候，其实我们是最紧张的时候，也是有100多个这个重症监护。那么现在才70几个。那么现在我们都知道，我们也会知道他们的需求。那么现在又是个人防护服的这个更新情况。那么不是所有的观众都是一开始收看我们的节目。过去的3天数字分别是538，周5到周6，周6到周日是507，周日到周一就是430，3天总数是1475个。那么其中分布呢是这个沿岸卫生局是287，飞沙卫生局是736，岛上卫生局是59个，北部内陆卫生局是217个，北部卫生局是173个，还有3个呢是疑似病例。那么目前为止记录在案的是5220例 active case， 我们可以看到越来越少。我记得最多的时候是要到了1万多，12000多，12月14号还是10039例。逐渐下降。那么现在住院的是358个人，总归是在350几、370几在徘徊。重症监护是72，最高的时候是12月31号是90个重症，不是12月29号80个，12月14号是87个是最高，基本上是80，12月上旬都是80。 以上，到了12月的下旬开始都是80以下，75以上。那么今天、昨天、上星期开始是75以下，74、72。当然也有网友猜测说，因为死亡的人多了，所以就诊监护的人少了。那么我们也可以从另外一个角度看死亡人数。那么现在这个3天呢是22个，平均是7个一天。上周呢也是8个。那么上星期汇报的是4天45个，就是超过10个了。那么12月14号我看了看，3天是49个，对吧？这个很明显，一天就是14个、15个、16个。那么12月的圣诞节前夕就是3天41个，对吧？也要13-14个，所以这个也是下来了。好，那么12月23号你看就是19个，所以所以死亡人数也是下降了。希望持续的看到人数的下降。这个也是 BC 省。今天我有一个大学同学也在跟我说，他说你们加拿大做得很好，我觉得跟美国比起来，加拿大是好，但是跟东部和比起东部的安省和魁省比起来，我们 BC 省做得更好。那么现在媒体提问时间。
You are limited to one question and one follow-up. Please also take your phones off mute. You are not audible until your name is called. First question today is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. You may have heard that Canucks training camp was shut down yesterday when a player had a positive test. Now, he's since tested negative twice, and the Canucks are calling the first one a false positive. The team said they don't use the 15-minute rapid test. So can you explain why there would be false positives in regular nasal swabs? And do you feel confident after several negative tests that that player is not actually carrying the virus?
So I
can't talk about this specific player because I don't know the details, but this is something that we have had to deal with all along. We know there are false positives and false negatives with all of the tests that we have. None of them are 100% what we call sensitive or specific. So those, it's a balancing that we find. The nasopharyngeal swab, depending on which lab does it and how well the swab is taken, the sensitivity, detecting somebody who truly has the virus can be as high as 98%, but it's not 100%.
因为就算是这个准确率是98%，还不是100%的准确率。
Especially when the rate is low and the pre-test probability is low, and we've been dealing with that all along. It's one of the things that one of our challenges with tests, and even the gold standard PCR tests that we're doing in the BC CDC lab, and of course my colleague Dr. Cranston will cringe at this, but even they sometimes have false positives and false negatives. It's innate in what we do, and why it's so important that we have the clinical context around that situation. Was there an exposure? Was there symptoms? Those are all things that are important. And yes, we more likely expect to have false positives in asymptomatic people with no risk factors.
更有说服力，更能够，特别是那些无症状的人。
Yeah, question for a colleague. Relatives of a senior at Peace Arch Lodge in Surrey recently learned after pushing for information that their loved one's scheduled COVID-19 vaccine was canceled due to an ongoing outbreak on their floor. Now, while it appears the shot's been rescheduled, how is public health handling vaccines in care homes with active outbreaks to ensure everyone who can still be vaccinated will get one and so they're protected sooner? And will those plans be clearly communicated to families?
Yes, and it has been an evolution. At first, we weren't sure whether it was whether we could give vaccine to people who were in the incubation period or exposed or who had been tested positive in the past. As more information became available, we realized that we were able to do that. Obviously, people who are positive today
那么如果今天
who
是
have
阳性的话，一
symptoms,
个
we're
人
not
或者
going
有
to, the
症状的
vaccine
话
is
那
unfortunately
么这
not
个
going to give them
疫苗
benefit.
就不能打。
But we do want to give it to people who
我们
have
只
been
能给那
exposed,
些
who are in the
或者
incubation
是有
period.
在潜伏期里
Some
边
of those
暴
people
露过
will
了。
have, it will be too late. They will already have enough virus that they will
那
develop
么他们
illness
可以打的，因为
regardless
这
of
是
having
他
the
们
vaccine.
有症状之
But for
前
some
打。
people,
有
if
些
they have
人呢
not yet been
还
exposed
可
in an
能没
outbreak
有被暴露
situation,
过
it
这
will
些情
prevent
况
that
下，
next generation
有
of
可能
exposures, and that's what we're hoping for. So there
也
has
可能
been
也
a
让他
shift
们
to
打，
a
这样的
focus
话呢，就
on
是可以保护起防线
prioritizing
所以这个也是给
care
我们
homes
不
where there
断的
have
来
been outbreaks to make
调
sure
整
that
优先
everybody
次
who
序。
can gets immunized, and
因为有些人已经有
we're
抗
starting
体
to
了，那
see
么就
some
慢
of the
慢打。
impacts of that. There have been people who in outbreak facilities who've received the vaccine who've gone on to develop disease, and that's not unexpected. But what we're hoping is it's going to take that tension away of, am I next? Is it going to be my room next or my ward next? So that's the focus that all of our health authorities have been pivoting to over I hate to use the word pivot, have been changing to based on the information and the more data that we get over the last few weeks. So as you say, that the initial concerns, and I know there were concerns initially from a number of different aspects, including immunizers who were concerned about going into outbreak facilities. But now we have our immunizers protected, both so they aren't bringing virus in and also so that they aren't at risk of virus as well. So a lot of things changing as we're learning more about how to effectively prevent transmission, particularly in long-term care homes.
Next question is from Bon Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Early in the pandemic, when discussing community immunity or herd immunity, we often heard the number 60% to
他说，在个疫
70%
情
might
开
be
始的时候，
enough.
我们都谈到
Lately
了
I'm
群体免
seeing
疫，一般是
estimates that it could be
60%和
considerably
70%
higher. I
有
see
抗
Dr.
体就可以了
Fauci in the
那么
US
现在看
saying,
看，
well,
现
it
在要
could
不
be
止
85
美国人说要
to
85%或者
Do you
90% 才是
have
群
you
体
had
免疫。
occasion to revisit those
那么你
estimates?
觉
And what
得
would be the implication if it is higher, please?
你看看
Yeah,
我们
so
是怎
we
么
have
达到
been,
这个程度，
thinking
或者是
about this
这
and
些数
talking
据
with our
我们也
modeling
考
teams
虑
and
到
others.
这个问题，
So
我们也
really
是做
what
过一些
we're
模型
looking
分
at for
析。
community immunity,
我们
herd
如果
immunity
在考虑
is
到
the
讨论到这
reproductive
个
number.
群体
That
免
gives
疫
us
的
a
话，
sense of how infectious a virus is or a
我们也要综合
bacteria
考虑
even,
看到这个
particularly
病
with
毒的
viruses. So if we
传染
think
性。
about the ones that we have immunization programs for, and this is important because the concept of herd immunity or
他说这个群体
community
免疫的
immunity
这个
really
概
is
念
about how many people need to be
是指
immunized.
还这个社区里边有多少人还需要去这个获得免疫疫苗这个不等于说有多少人已经有这个病毒了或者是细菌
It
了。
also has the inherent risk of hospitalization and death, which we're trying to avoid. So
所以我们要避免的
the
是
concept
更多
of
人
herd
去住
immunity is
院
based on
和
our
重症监
reproductive
护
number.
去
And if we look at measles, which is the most infectious virus that we have an immunization program for,
那么他也是说到了
and
这
measles
个
has an R
这
naught
个
of
我一下
about
疟疾这
13
个
or higher.
病毒这个是
So
普
we
遍的，
think
大家考
about
虑流行病
influenza,
学
it's
的
down
一个
around
比较典型的。
1.5 or so. For this virus, we're seeing it somewhere around 2-ish, the R naught, so in the the naive population. So that if we look at an R naught around 2-ish, then we're thinking if we have enough, 60 to 70% of the population is immunized, that should prevent those transmissions to most people.
那么他也
It
是说到
still
了
will
这
not
个病
prevent some
毒
of
刚
those
才说
super
的这
spreader
个
events if they're
疟
in
疾
the
的疫
right
苗的这
situation where you
个
happen to
病
have an
毒
ill person
那
and a
么
bunch
只要
of
人
people
体
who are
里
not
边
protected
60%和
in an
70%的人有
indoor
这个
situation with
免疫
crowds,
系统的
etc.,
话
or
那病毒
ventilation.
就传播不
But
了
that
了。
could be, that could be enough to stop
所以
that
这个就是
widespread
很
community transmission.
已经有这个足够的
Where I think Dr.
防
Fauci
线
and others
那
are
么
concerned
福奇
about
医生
is
美国的
the
福奇医
increased
生那
transmissibility
么可
we're
能
seeing
也
with
是
some
考
of
虑
the
到
things
其他
like
的
the
这个病
UK
毒的
variant.
包括
And
了
as
英国的这
the
个情
R
况
naught
他
goes
们
up, and they're saying
因为
maybe
现在
by 0.4 or 0.7, so from
那么
2
现在这
to
个
2.7 or 3
RT 值现在是
somewhere
1.7，
around
就是
3.
那还
then
没
you
到
need to have more
2.1
people protected
那么这样的话
before you
呢
can prevent
没有
those
传播更
transmissions.
多
So
的人，这样
before the
的话
virus
更多人
runs
需
into
要
dead
保
ends
护
wherever you go. So yes, people are
所以
concerned that with particularly variants that we're seeing arise, that we may need to immunize more people.
所以我们需要让更多的人能够得到
Continuing to
免
look
疫
at as we go, I think that probably 70%
所以
is
可能是
something to aim for.
70%
But of course,
是
we
以
want
上
everybody to
我
be
认为这样
protected
的话才
as
能
soon
够
as we
保证
possibly can.
我们希望能够
Bond, do you have a follow-up?
70%社区的人能够得到免疫，这样的话呢，这个群体免疫就
discussing
有
the
了希
issue
望。
of healthcare workers
所以
and
他还是
workers in long-term
70%，
care
美国
refusing
刚
or
才这个记
choosing
者
not
问的
to
是
be
85%到
vaccinated. We've
90%。
heard that, well, it might not be a problem because most would be vaccinated, and so if herd immunity or community immunity is low as 60%, then that wouldn't be an issue. But I'm wondering if it is higher, would thought have to be given to reassigning people in long-term care or health care who choose not to be vaccinated?
Yeah, probably not reassigning. I mean, this is something that we've considered for many, many years, and around influenza immunization
他
every
也是
year,
说到了
where
就
it is
像
so
流感病
important
毒
for us as
流感
healthcare
疫苗一
workers,
样对这
because we know
个我
that
们的
the
医护人
influenza
员的
vaccine
这个施
doesn't work
打
as
疫苗
well,
的情况一样。
particularly in older people and people with a compromised immune
所以
systems.
不会存在
So
着让他
really
们
they
调
are
动工作，因为
dependent
有些
on
人
us
不愿意
not
打，有些
bringing
人不打，有些人
influenza
打。
into a long-term care home, for example. And we know that with concerted efforts, we can get immunization rates up to 80%. And that has a protective effect,
所
particularly
以
in
他说，
long-term
只要
care
这
homes.
个长期护理院里边，只要达到 80% 的人打过了，
is this
那么这
vaccine
个长期护理院就
provides
是建立的
protection
防
to
线。
elderly people as well. And from what the trials show, that's very good protection.
所
So
以
that
他说，
helps
注
us
射
as
在
well.
第3期
But
试
the
验的
other
时候，已
thing that
经
is
表明出
incredibly
了第一
important,
针
we
打
do
完
not
之
yet
后，
know
这
from
个
this
效率
vaccine
很
whether it's
高。
going to prevent infection and that low level of transmission that
那
can
就
happen.
算是
So right
获得
now,
感染
we
了，他
all
们
need to
也这
continue
个
to take those measures like wearing
传
personal
染性也
protective
很低啊，
equipment,
没有说是
keeping
打
our
过的，
distances
就是
from
说
each other in enclosed spaces.
有
All
些
of those
即使
things
是
that
就是
we're
打
trying
过
to
的
do
地方
now,
的，有
monitoring
些
ourselves
人
for
没有打了，
symptoms
那么
every
他也
day,
获得
getting
了这个
tested
病毒，那么
regularly.
它的传
Those
播性就
types
很
of
低。
things will need to continue for the
不大会传播
foreseeable
了。
future. We will have more data by next week
他
about
说，我们下
coverage
星
rates
期
in the
我们
care
会有一
homes
些
that,
更多的数据，以
that we're
及
immunizing
快
last week and this
我们
week,
会
and
看看这个接下来
we'll
的
have a better
这
sense of that.
个，
But
我
I'm
们会有
also
一些
hearing
数据
from
看看
many,
到底
many
这个打
care
了
aides,
之后的
nurses,
走向
physicians
我们
across
现在也
the
希望医
province
生
and
啊、
from
护
my
士啊，包括这
immunizer
些
colleagues that the
我们
uptake
的一
is very,
些
very high in BC.
那么
And I
这
think
个
that
接
has a
触
lot
的
to do with
高风险
being
的
open
人群
about
看
the
看他们
vaccine,
要
about what we know, what we don't know,
所以
providing
我
people
们
with
也
the
要
I
看
mean,
到
people
随着
absolutely
疫苗
have
的
questions, and
施打
that's
的
what
人
we
的
are
增
there
多，
to
我们也
answer
很多的
so
数
that
据
they
可以
feel
看到
confident receiving the
很
vaccine
多未知
and
的
knowing
数
that
据
it's
领
safe
域，
and
我
that
们
it
都会
works.
分析出来。那
Next
么，所以
question is from
但是我
Camille
们有
Baines,
一
Canadian
点就
Press.
是我们很自信，现在这个疫苗
Hi, Dr. Henry
能
and
够有效
Minister
的
Dick.
防护。
Considering the outbreaks at hospitals, acute care settings across the province, including at St. Paul's among cardiac patients, why is routine pre-op testing for COVID-19 not being done except in the Fraser Health region, despite rising positivity rates?
Yeah, so we have a whole process around when we're doing that type of testing, and it's based on risk in the community, percent positives coming in, and we started it in the Fraser Health region. As you will recall, that's where the rates were highest, and it only changes one's management in certain conditions. So, pre-op is one thing, and the cardiac units are not pre-op. So there are several different areas where we are doing routine testing of people, depending on the situation in the community and the rates in the community. As well, there's a very high index of suspicion, but sometimes cases are missed.
都会不一样。那么有些地方他解释了，因为一个记者问的就是有一个
Yes,
长
I
期护理
do.
院为什么
I
没有
understand that
有时候漏了这个做测
the
试。
Northern Health Authority,
那么又
for
说到了
example,
北部卫生局
the
下面
prevalence rate went up from 0.5% in October to 17.5% in the first week of January, and this is data from the BCCDC. So why wouldn't testing be done there before patients come in for surgery?
If we look at where people are, who is getting sick and where they are getting sick and how we understand the transmission in the community, it's not necessarily people who are waiting for surgery who are at risk. So it really depends on the local epidemiology, and absolutely Northern Health has had very challenging few months. But particularly the last few weeks, their percent positivity continues to increase. But it is very much limited to communities where we're having ongoing contact tracing and contact management with public health. But these are things that they monitor carefully.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Hoping to ask you today more about the vaccine distribution and whether or not you've encountered any problems with doses having to be wasted yet because they're not handled properly. And in some COVID-free zones, I'm also hearing from people complaining about still being confined to their rooms since November when they're not anywhere near being exposed to it. So mainly, just have you encountered any problems with vaccine doses being wasted?
No, so far so good. We put a lot of time and effort into making sure we had people trained, that we had the infrastructure in place, and we talk about over the Christmas weekend not putting enough doses in people, but part of that was making sure we had the right equipment to be able to safely move vaccine and the right vaccine to be able to do that, and that people knew how to handle it, because as I've said a number of times, there's a lot of fussiness about making sure the vaccine is stable. So no, as far as that is one of the things that we monitor quite carefully, vaccine wastage. We have not had any serious concerns with vaccine wastage, and there's a process in each health authority for once the doses are coming up to the end of the 6-hour period, if there's not people there for their appointments, that we have other people who are on the priority list who are able to come in and receive the vaccine. So I've not heard of any concerns. In terms of people, it is something that, of course, we're watching very carefully. In terms of long-term care homes, we are still at the point of giving everybody dose 1, and it takes time for your immune system to develop enough antibody that you are protected. So it's a couple of weeks after dose 1. So we're not yet at that point where we can let up on keeping people safe distance, on wearing PPE, and reducing the numbers of people who are going into long-term care homes. But that is the future. That is what is going to happen once we have everybody protected in those communities that are most at risk, and that's our aim, priority 1. Across the province.
因为现在全省对我们来讲，重中之重就是重点就是长期护理院。
The tools in your box right now to try to keep numbers coming down, because we have noticed that numbers have slowly kind of dropped a bit, but we're still seeing 22 people die over the weekend. So what more do you think you're prepared to do to ensure that people are following the rules when we are still seeing some people ignoring them?
So we're obviously thinking about lots of things. We renewed our orders as of Friday and kept them the same, because we know we're not out of the woods, and we saw this in October where we started to have a bit of a dip, and with cases of 500 a day, that can start to go up exponentially very quickly. So this is such a critical time. I get so challenged with it, because I know how tired we are. We hear these stories about politicians in other provinces going off on vacations and things, and thinking that it's not serious enough. But we know what we need to do here in BC, and we know that we can get these down even further. We watch what's happening in Ontario and Quebec and next door, and where hospitals are getting overwhelmed again. We need to keep holding our line
所以
here
我
in
们一定
BC.
要建
And
立
that
我们的
means
第一道
keeping
防
our
线。
social gatherings
所以我
small,
们一定要
making sure we're
使得我
using
们
all of
的
our
社
layers
交
of
的人
protection
群
in
越
our
少越好。
workplaces, that we're not letting our guard down right now. Right now of all times, we have to step it up because
所
there
以我
is
们
an
每个
end.
人都要一
And
行
we're
动
at
起
that
来。
part in the marathon when we're tired and we can stumble and get
就像
injured,
我们
but
现在马
we
拉
need
松一样啊，
to
跑到
support
一半
each
大家
other to
累
keep
了，
this
我们希
going
望大家都能
because
够
there is an
相互
end.
支持、相互
And
提醒，能够跑完
it's
这段
part of
路。
it's because of vaccine and part of
马
it's
上疫
because
苗
we're
来
keeping
了
our
密
rates
生
as
马
low as
上
we
就要来，
can.
而且疫苗
And
是有
that
效的
saves lives every day.
因为疫苗是
Richard Zussman,
能够
Global
拯救
News.
生命，我们每个人这么做也是在拯救
We're
生命
hearing。from the restaurant and bar industry again, Dr. Henry, around concerns around the communication of the new rules brought in before New Year's Eve. And they would like to know if you'll make a commitment to ensure that there's better communication
那么
next
他也是
time
代
there
表
are
了
changes
酒
made
吧
in the
餐饮业
restaurant
你
or
们
bar
在元
sector,
旦前突然
including potential
发了个禁
changes
令，
around
那么这个沟
events that
通
could be
不
coming
好
up in the near
你能不
future,
能承诺
and
我们
whether
将来
you
对这
acknowledge
些业
that
主
the
有一个
communication
更好
could
的
have
沟
been done
通
differently around
能
New
够
Year's Eve.
和不一
I
样
would
新
just say
年
that
元旦前的这个不一样
the
这样的沟
communication
通不
around
好
New Year's Eve was done for a very specific
因为他
purpose.
说元旦前夕的这个禁
Because
令呢
of the
是特别
information that
特
I
殊
was
特别特殊
receiving from the beverage industry, from the restaurant industry, but also from municipal leaders, from others in the community who had concerns about things that were
因为
being
我做这
planned.
个决定呢
And
也
we
是出于很
had
多人的焦
discussions
虑
about
很
what
多
were
人
the
的讨
public
论
health issues that
包
we were
括了
trying
市
to
里边
address.
的
And it
领
really
导
was
以及
about
餐饮业联席
overconsumption
会
of
以及
alcohol
我
later in
们
the
各个
evening. So
卫
that's
生
why
局
we
的领导人
targeted all of
我
the
们也看
places
到
where alcohol can be
我
sold.
们
So
也看到了
stores,
这个考虑到
grocery
这
stores
个
that
酒
sell
精的消
alcohol,
费量
restaurants and bars. And that was done at short notice
所以
because
因
of
为
the
那是
issues
很
that
短的时间
arose.
里
And
边
I
通知
needed
大家急出通知
we with
因为我们知道这个
we
一定
had
要
an
立刻
imperative
采取
to
行
take
动
some action,
不然的
knowing
话
what we
这个
knew.
数字就会
I know
情
this
况
has
就
been
会
a
很
hard
糟
year for the
我也知
restaurant
道这
industry,
个
and I
餐饮
am
业和酒吧业
committed
今年特别
to
困难
making sure we can do what we
我也
can
承诺
to
给大
keep
家
them open
我是
safely.
希
And
望
I
你们能够
absolutely
安全的
applaud
开
how
业安
many
全的营业
restaurants are doing amazing things
所以我也
to
知
keep
道
things
很多
going,
很
to
多的餐
provide a
厅做得
safe
很
place for
好
people to
为
get
大
out
家
of
提
the
供
host, to
安
have a
全
meal,
的
to
又能够
do
安
that
全
in an
的这个
environment
消费
that's
场
safe.
所
And I personally appreciate
所以
it
我个人来讲也很
because
感
I
激
think
他
I
们
probably would not have got through this last year without the support of the many great restaurants that I have been privileged to go to. I do meet, my office meets every couple of weeks with the beverage and restaurant industry representatives, have been for many months, and I've committed as well to having a discussion with them about coming events over the next coming months to again look to them for ideas about the things that we can do to make things safer for people and to make sure that we're doing everything we can to support the industry on the other end.
尽量的来支援你们支持你们那么卫生厅厅长要做一些补充
And just to add, I think one of the strengths of what we tried to do in BC, and I think one of the reasons why there has been I think strong support the measures put in place by Dr. Henry is the consistency we put forward over time. If you look at many jurisdictions across North America and across the world, you've seen very significant changes day to day and speculation about changes all the time, and pretty consistent here. The change we're talking about, I know people in the restaurant and bar industry didn't like, which was to change last call by 2 hours on New Year's Eve. But if you look across the country and in jurisdictions that have significant rates of COVID-19 in Quebec and Ontario and Manitoba, Alberta here, I think the consistency of what Dr. Henry has done has made those measures more effective, I would argue, and also has been a hallmark of the way we've approached COVID-19 in BC. So I know that there was concern around New Year's Eve. I know that many people in the industry felt badly about it. But the consistency of approach has been beneficial, I would argue, even to those industries themselves. And that's going to continue to be our approach. And I think and every decision I know from Dr. Henry, every decision that she takes and that we take, consultation is important, but also the consequences of that decision, intended and unintended, are always considered. And I think that in general, we've been on a good path for that reason, and we have to continue on that path. But people have to dig in now. This is an important moment in COVID-19 in BC. It's absolutely critical. Vaccines are being used, and we'll have immunized about 10% of the population by March 31st, which means we've got a long way to go to that point and then beyond. So right now is a time when it's more important than ever.
所以这个大家听出来了，就是卫生厅厅长他是一个政客，而 Bonnie Henry 呢，他是个科学家，所以讲话，当然他这个科学家还是带了行政的作用。当然了，这个从政客的角度来讲，他说话不如这个卫生厅长的这个技巧和技术啊。
Far less regularly now. And as you acknowledged at the beginning, today is a grim milestone with over 1,000 deaths now here in British Columbia. Why have we seen a more rapid spread of the virus in long-term care recently?
他说了，这个今天的这个数字啊，也是历史上值得纪念，因为今天的数字是1010个人，超过了1000人的死亡。为什么这个死亡都是集中在长期护理院？
So are you willing to put in those additional layers of protection and testing in long-term care?
那么你们用在这个北美冰球联盟的这个测试的策略也可以，为什么不用在这个长期护理院啊？那个为什么病毒的爆发这个厉害的就基本上集中在长期护理院？那么他说我们现在即使采取了每一个员工只在一个长期护理院工作的这个政策已经几个月啊，我们也是经常保持测试。
this time of year.
那但是呢，这个今年的这个病毒这个时间是最容易传播的。
30,000 staff who work in long-term care homes around the province.
那么现在全省呢有3万多个员工在长期护理院工作。
It reflects exactly what's happening in our communities.
完全反映出了这个
I think the challenge that we have
病毒在社区里边的传播的这个情形。
We have all these measures in place, and it's very difficult to pay attention to them all the time.
所以他们3万多个人也是时时刻刻要注意自己，也是很困难。
Personal protective equipment, making sure that people know how to use it appropriately, doing that active screening every day when you go into work.
正确使用，不是说你用了防护服就好。
Testing, and we have been doing testing. When there's an outbreak, there's testing of everybody, asymptomatic testing of everybody on a periodic basis. Trying to step up the screening, and absolutely, we'd be open to doing. We've been looking at the rationale, doing nasopharyngeal swabs twice a week. I know Ontario's been doing that for some time, and it does in some cases help, in some cases not so much. So we have been absolutely looking at all of the options. I'm happy to hear that we're focusing on things like nasopharyngeal testing. I will say that all of these take resources, and do we have 600 nurses go to each of our care homes to do the testing? We can divide it up so there's maybe not that many, or do we focus on some of the other important issues like reinforcing the screening and the infection control measures within the facilities. All of these things are being looked at on an ongoing basis, and with every outbreak, we learn a little bit, but absolutely, it's an ongoing iterative process.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID-restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Susie De Silva, CBC.
Thank you very much. Dr. Henry, you mentioned earlier, and I know Mr. Dix mentioned this as well, that we're out of the Pfizer vaccine, expected to be out by the end of today. today. Does that mean that we are vaccinating with Moderna across the province, or is the rollout stalled, especially in urban areas, until we do get more of that Pfizer vaccine?
他说了，因为你今天提到了我们的疫苗马上要用完了，特别是辉瑞。那么他说，莫德纳马上会来，人家就承诺了，他们已经承诺已经在运过来了。那么因为我们只要把莫德纳的疫苗呢，就要偏远地区、小社区，所以我们一旦用完，今天就用完了辉瑞的话，那么这个礼拜辉瑞会下一批会有可能明天来，有可能后天来，有可能礼拜五来，现在不知道。现在看来疫苗就没得打了。我们也现在知道，我们也是在他们的这个承诺的名单里边。
Each of the lots will be coming to what place in the province. So it is something that we are still trying to be nimble with and work through with our federal counterparts who do the delivery service. And I was very heartened to hear from our federal ministers that they're looking at trying to increase the amount of Pfizer that we receive earlier rather than later, so we can ramp up to give more.
希望能够加快这个运输生产给我们的速度。
Yes, please. Have the daily testing numbers increased to the level we were seeing before the Christmas holidays yet? Can our lower case numbers over the past few days be attributed to lower testing rates still, or perhaps that people did follow the rules over the holidays? And can we also get an answer in French?
I'd like to say both. Yes, so our testing rates have come up. They're not as high as they were prior to shutdown of some of the industries, etc. So we have been including, we've separated out what we call MSP and non-MSP lab testing, some of which is industry testing. So most of that hasn't come back yet, but we have been up in the 9,000, 10,000 range prior to the weekend. And I believe it was a smaller number yesterday. This number was only about 5,700 cases. So we do see a periodicity to the testing, and today's numbers reflect that yesterday on Sunday not as many people go for testing. But they have come back not to the same levels, and it's hard to know because we look at our percent positive, and that tells us, are we getting people who are more likely to be, are they directed to testing because they have symptoms or because they've been told by public health or tested by public health, and there's some of that, and that's reflected in the increased test positive rates, and some of it, hopefully, is I don't dare say, but is lower levels, levels coming down in the community. And I do believe that is part of it, and I just want to encourage everybody to keep doing what we're doing because it is working and it's saving lives, and our families and our communities.
这样的话，你做正确的事的话，就能保护生命，拯救生命。
Just say with respect to vaccine, there's
那么也是说到了疫苗的問題。
Right now we're sort of looking at vaccine on a daily basis.
我们每天也在看，我们能够获得到多少疫苗。
We've essentially used up all of the Pfizer, and we've allocated or used all of the Moderna vaccine that we have. And more will come later in the week, and this will be part of what we'll see for weeks and weeks to come. And so it's not a reverse of things. We're working closely with the federal government. We know they're doing everything they can with the 7 contracts they have with vaccine, there's 2 of which are operative now with Pfizer and Moderna to get vaccines to us, and we're doing everything we can to deliver it. So it's not it's our expectation in the weeks and months to come will be for a team effort, and so it's not criticism of anybody that we're out of vaccine. It just happens to be because we've used it all up that we're out of vaccine for a short period, and then we'll have hopefully quite a bit more. En français, je dirais que
在过去的3天周末，礼拜5到礼拜6新增了是538，礼拜6到礼拜天新增了507，礼拜天到礼拜1新增了430，貌似看上去数字在低，但我不认为这个每一天，明天可能就600了，也有可能700，这个是反弹的，这个因为这个数据的截取的时间点不一样。那么3天呢是1475个，其中 延安卫生局新增287个，飞沙卫生局3天里边新增了736个，岛上卫生局新增了59个，北内陆卫生局过去3天新增了217个，北部卫生局过去3天新增了173个，疑似案例又有3个。那么目前为止记录在案的活跃案子是5220例，其中358个住院的里边有72个在重症监护。那么很遗憾，过去的3天里边呢，新增了22例死亡，本省第一次死于新冠相关的。就是到了超过了1000，现在到了1010个，很遗憾。那么到昨天为止呢，这个疫苗已经有59902人获得了疫苗。那么今天呢，也是跟大家解释一下，辉瑞的疫苗到今天为止全部用完了，明天就没有打了。莫德纳呢有，主要是给偏远地区打，但是这个礼拜不是明天就是后天，反正就是这个礼拜辉瑞还会到一批货，所以大家不要太焦急。我们的联邦官员也是在积极的向美国的厂家在要。好了，那么今天的这个新冠疫情的 BC 省的新冠疫情的新闻简报呢，也就给大家解说到这儿。感谢各位网友的收看，我们也祝大家在新年里边健康快乐，同时也欢迎下次本周礼拜四同样时间收看我们的新闻这个新冠疫情 BC 省的新闻简报直播。好，谢谢大家，拜拜。